Hi everyone, my flashcard this week is on Alzheimer's or AD. Working in hospice, I deal with a lot of patients that have Alzheimer's disease. They often stay on our services for sometimes years because they continue to show decline, but the progression of the disease is sometimes very slow. So AD is a form of dementia characterized by neurofibrillary tangles and abnormal neuritic plaques leading to progressive atrophy of the brain cortex, dilated ventricles, and sulci widening. Senile plaques contain amyloid beta peptide and prevent proper neural conduction. Neurofibrils and plaques are not always present in those with dementia and have also been found in the brains of those without dementia, suggesting that their allocation and prevalence determine the presence or absence of dementia. AD is also associated with an acetylcholine deficiency. Late onset AD is the most common form of elderly dementia and occurs in those above the age of 65. Early onset is rarer and considered to be cases occurring in those less than 65. The disease is invariably progressive and individuals affected live anywhere between 4 and 20 years from onset. Risk factors for AD include increased age, genetics, Down syndrome, metal exposure, viruses, metabolic syndrome, history of TBI, depression, cardiovascular and cerebrovascular disease, and smoking. The most common early sign of AD is a loss of short-term memory with long-term memory still intact. Other early signs include inability to learn or concentrate, impaired reasoning, and behavioral changes such as irritability, hostility, and mood swings. Late signs of AD include inability to recognize loved ones, garbled, limited, or absent speech, being fully dependent on ADLs, neuromuscular dysfunction. General signs and symptoms include cognition and language skills that progressively decline, impaired judgment, disorganization, inability to problem solve or think abstractly, apathy and confusion, functional decline, wandering, incontinence, agitation and psychosis, and altered sleep patterns. There are no definitive tests to diagnose AD, but it's supported by abnormal mental status exam that evaluates concentration, short and long-term memory, language, visual spatial processing, and executive functioning. Biomarkers can be assessed from CSF fluid, but this test is often difficult to perform on these patients. It is important to do a full neuromuscular assessment to rule out other differentials. PET and MRI scans may demonstrate plaques and cerebral changes. The Mini Mental Status Exam, or MMSE, is a less specific and sensitive form of screening that is widely used by healthcare providers, used to determine whether an individual is performing at the standard cognitive capacity of their specific demographics. And this picture above shows a healthy brain versus someone who died with Alzheimer's. That's it.